That's exciting for your patients. They like to see those changes.
Hey, welcome back to AMC. I'm Dr. Miller. We're in a series on the value of internal protocols. Today we're going to cover the topic re-exam and re-x-ray with Dr. Shannon McMurtry. Let's go ahead and get started.
Hello, everybody. Today the subject is re-exams and re-x-rays. This is a sorely needed topic throughout our profession, and unfortunately, we are not even living up to the minimum standard of care for the most part in our offices. And you know what's dangerous about this is you don't have somebody looking over your shoulder auditing your charts like you did in chiropractic school. You're basically left to your own devices unless something happens and you get an audit, or your malpractice carrier starts looking at your charts, or certainly, in heaven forbid, you have to defend yourself in a courtroom. So we're going to talk about re-exams and re-x-rays. Probably not the most fun subject in the world, but certainly a necessary subject. I am Dr. Shannon McMurtry, and I have been working as a chiropractic coach for almost 20 years now. And this issue is a hot topic for me and the clients that I serve. Let's talk about re-examinations and re-x-rays as part of that re-examination process. First and foremost, you have to understand this service is needed. Every other healthcare practitioner who sees patients over a treatment program has to do recertifications or re-exams or whatever to basically document efficacy of care up to this point and reset the plan moving forward. You look at people like therapists, OTs and PTs and speech therapists, they do this process, and guess what? It's either monthly or about every 12 treatments or visits in their clinic, and that's at a minimum. There are some situations where they have to do it more frequently than that. And the insurance providers, the hospital administration, whatever entity that they're working under and whatever reimbursement plan that they're working in, these organizations expect those reevaluations and re-exams to be performed. So you're one of those types of practitioners. You see a patient over a treatment program, whether that's a shortened program or a lengthy program, and re-examinations are a needed part of that patient management and patient care. They're necessary too. They're necessary for you as a provider to see what's happening with this patient and document it as a formal process. We need to have those regular reevaluation events that shows how this patient is responding to care, any setbacks that they're having, any other things that are now popping up that weren't on the original chief complaint list. And this gives you a regular continuity in your care beyond your day-to-day treatment log and your treatment notes. It's necessary for you as the practitioner because the patient changes over time. If you're doing the right kind of work and this patient is changing in how they feel and how they function, if we're removing those subluxations, changes are happening inside that body. Changes are happening with function. And if we're not documenting that or documenting where it's lacking compared to what is normal for us or what our expectations are, how are you possibly going to change up the treatment so that that patient can get your very best every single day? So it's a needed thing, both from a type of care that we provide and needed for the patient, and it's necessary for us as providers to give us the data that we need to help this patient get the very best results they possibly can. The reality is it's not happening in the chiropractic office. And I understand that. As a chiropractor, I understand that you want to provide the best results possible for that patient's dollars, and sometimes that reeval, especially a re-X-ray, can sometimes feel like, well, what am I actually getting out of this information? I can invest that patient dollar into adjustments or into therapy or into nutrition where I know we're going to get a response and get improvement in their total health. Well, that's true. And quite frankly, some of us are actually afraid to do reevaluation or re-X-rays because we're concerned that we don't have the changes documented and we're going to lose that patient. And we have to get that concern off of our mind because, again, you're just looking for data and you're looking for data that helps you provide the best treatment moving forward, kind of independent of what you've done up to this point. It's also not happening because we're not organized enough. We're not scheduling this as a separate day event. Now, I know I just shocked some of you. Maybe some of you have already turned me off right now, but let me make my case to you. The doctors who try to double up treatment services and evaluation services, re-exams, those doctors never hit the numbers that they should be hitting based on their practice profile because reality happens, life happens. If you are running behind, which some of us do, or the patient is running behind, what are we tempted to do? Hey, Mrs. Jones, I'm running behind. I apologize about that. I know that you have a re-exam scheduled today. We're going to do that next time, and let's get your adjustment done today. Patients always agree to that. Sure, doc, whatever you think. The problem is we don't tie off that thread, right? We don't go to the front desk. We don't say, hey, let's get that person booked and let's move that event or that reeval to the next visit. And that thing never happens. Same is true when the patient is running behind. Doc, I'm sorry I'm running behind today. I know it's okay, Mr. Patient. We're going to get that adjustment done today. That's the most important thing that we're doing for you anyway, and then we'll get that re-exam caught up. Both you and the patient are well-intentioned. We just don't have the follow-through and the organization necessary to move that service to that next day. So we have conceptual problems, we have judgment problems about dollars spent, and then sometimes we have organizational problems, which all prevent and add up to us not doing our re-evaluations and re-X-rays. There are consequences to this. The consequences are patient is not getting updated information. Again, that body should be changing. What if this has never happened to anybody who's watching this, but what if you actually are adjusting that patient with a wrong line of drive, wrong segment? What if what you thought you were doing is not actually supported on that X-ray? And you just continue to adjust. Patient's getting better because chiropractic is amazing with that. But what about that target area that is really where the concern is? The damage or the disc that's unstable or whatever. Are we really getting changes and healing down in that segment? How would you ever know that unless you took some new pictures, unless you reevaluated? There are times where on that reevaluation, and I show the report to the patient, I compare their x-rays, there are times when that second x-ray looks worse. Imagine that. But the patient is improving from a physical standpoint. Their range of motion is better, their pain is better, the swelling is reduced. We're getting all the positive indications on the physical side that we're moving in the right direction, but that x-ray, that snapshot in time, actually looks worse. The patients are okay with that, right? They're okay. They're not going to look at that x-ray and say, oh my gosh, doc, you're hurting me, you're taking me backwards. And we have to get that fear out of our system. We've also had the opposite. I've had patients who are physically very, very difficult to get response because of how complex their case is or what other complicating factors are going on. And then we'll look at that x-ray and we'll see, man, these are magnificent changes happening in a short amount of time. We're definitely on the right track again. Had I not done that reevaluation, had I not done that re-x-ray, I would have been likely to dismiss this patient for fear of them not getting the results that they should get. See, there are consequences to not doing those reevaluations. And the consequences are always lack and quality of patient care. And sometimes we get intimidated by managing that case and don't think we're doing a good job. And we dismiss the case prematurely. And now this person is maybe left in the lurch, or now they're taking more invasive measures for that problem. Well, that's serious. So there's consequences of that. There's also benefits. The benefits are you always know where that patient is with their care. You always know what you're working on and what your objective is over that time span. The patient is aware of how their body is changing and what's going on inside, independent of how they feel, right? Chiropractic, again, very effective, pretty amazing at the pain control and the pain reduction, but what's actually happening inside that body? What's happening with that scoliosis or that disc wedging or that unstable disc or that degenerative disc disease? See, monitoring that over time, that's exciting for your patients. They like to see those changes. They like to know legitimately what they're up against if those changes are hard to come by. So there's benefits to you and the patient from doing this service the way that you're supposed to be doing. And one of the benefits that you may not realize is the benefit to your confidence and your conviction about what you do. When I started chiropractic care long ago, the conviction that I have and the confidence that I had as a practitioner is not where it is today. And what changed? Experience. Seeing all these different cases respond successfully, seeing patients improve that everybody else had said, oh, there's nothing that can be done for you. You have enough of those over time, and you actually see what's happening and document what's happening with the changes in that function and see what's happening in the changes on those x-rays. Man, that is inspiring. And it gives a level of confidence that just cannot be faked. Confidence to you, confidence to your team. And the more confident you are, the better the patient feels and thinks about you. I don't know if you know that or not. Your confidence has a big role to play in that patient's trust of you to get the results to them that they need. So I know this isn't an easy conversation to have. You know, a lot of us are missing this and have actually talked ourselves out of doing these services. Unfortunately, some of the schools are saying don't do these as well. And that's horrible advice. You are a chiropractor. You judge your standards of what that patient needs. You're seeing people over time. You're expected to reevaluate. And it's important to see not only what's going on outside, but also see what's going on inside of that body. If this is a subject that is resonating with you and you realize you're not up to speed and you have no idea how to get there, let me know. Let us know. We will be happy to map it out for you, explain it to you. It's really easy. Once you get all your organizational stuff done and you get over some of the fear components and some of the other things, this is a super easy thing to implement into your office, and both you do, your patients do better, and your practice does better. So thanks for your time today. Hope to see you next time. And until then, have a great rest of your day.
Thanks for joining us today. We've got a training boot camp coming up in Atlanta on January 28th through the 31st. If you'd like more training just like this, or you just want to check out ways AMC can help your practice, contact us for a free guest pass today.